This is Pet Life Radio. Let's talk pets.
This episode of Vet Candy is sponsored by Elanco Animal Health, makers of Ultra Duramune, a more comfortable vaccine.
Welcome to another episode of Vet Candy's podcast in other news. I'm your co-host, Dr. Jen.
And I'm Dr. Jason.
And if you are not yet a Vet Candy subscriber,
why not?
Please subscribe for free today at myvetcandy.com. And for all messages with love and positivity, you can reach me at Jen at myvetcandy.com.
And as usual, those of you guys who like to keep it real, you can reach me at Jason at myvetcandy.com.
Okay, well, let's get into it today. We're talking about...
What are we talking about? You know this is not my job.
Oh, yeah, you don't have it?
I don't have any idea.
That's right.
I just show up.
We're going to talk about tick-borne diseases.
Tick-borne diseases. In other news, Lyme disease isn't a cocktail?
No.
I swear it's a cocktail. If not, it should be.
It is not a cocktail.
It's a good name.
It's a good name for a cocktail.
Yeah, okay.
It is.
Yeah.
It is. But so what do you know about ticks?
Well, now that I know that they can spread Lyme disease, you just said tick-borne diseases.
Mm-hmm. Anything else?
They're small.
They're small.
Yeah, they're really strong.
Oh, they are.
Yeah, I've seen the movie.
Yeah.
Right? They're really strong for their size. Really strong for their size.
Yeah. They do a Tarzan move.
I don't even know what that is.
I know, but we'll talk about it.
We'll get into that. That's pretty much it for me.
Yeah, so into the Candyverse, as per the usual, we're bringing an expert to you.
Oh, I see you're getting that. We weren't the expert. I opened my mouth and proved it for all those that doubted. I'm not a tick expert.
That's right, me either. But luckily, we know guys who know guys.
Yep.
And joining us today, and girls, joining us today in the Candyverse for the first time,
dun, dun, dun.
Inaugural visit to the Candyverse is Dr. Dawn Martin.
Hello.
Hello.
Well, thank you for having me.
Thanks for being here.
I really appreciate it.
So I should say a little bit more about you for the news hounds so that they know. So she is actually a board certified internal medicine specialist.
What?
I know, right.
That's awesome.
Yeah, that's the folks that sit in the front of the room and get 100 and blow the curve for everybody.
Yes, that's
right?
not so awesome.
They know.
These are the folks that have a lot of letters, right? They learn a lot of stuff, right?
Yeah.
Not like me.
Right, exactly. They learn a lot.
Mm-hmm.
No, they're the medicine specialists, right?
Yes.
Yeah. So if we have like a hard case, we're sending it to you.
If you know why, maybe if I have an easy case, I'm sending it to you.
That's true.
Oh, I like those too.
Good. Everybody does.
I like those better.
You know me.
Yeah.
Pearl.
Okay, so first of all, since it's your first visit to the Candyverse, we need to know a little bit more about you. So, like, where are you from? Where'd you go to vet school? How did you decide you wanted to, focus on medicine?
Well, thank you. So I'm actually from Canada.
What?
We
I know.
We gotta say A after everything?
let a Canadian into the
it's terrible. I
Candyverse.
probably shouldn't have said
Into
that.
the country.
Into the country.
And then into the Candyverse.
The Candyverse. That's very cool.
Not only from Canada, from the most eastern part of Canada, Newfoundland. So I am from Newfoundland.
I'm sorry, is that a place? I thought that was a dog.
Yeah, you'll learn.
It's
You
a
don't.
dog,
You gotta
it's
keep
a
talking
place,
here.
it's an island, it's so many things.
It's a dog. It's a place. It's an island. I love it.
That's it.
It's so very
all of
many
those things.
And it's home.
And home.
Okay.
All wrapped in one little package.
Awesome.
So I grew up in Newfoundland, which is a very small place, a very low population. I then moved on to Prince Edward Island, which...
PEI.
Oh, that's how we know it.
Right?
PEI.
Also known as Anne of Green Gables land.
Oh.
Right? I
yeah.
think everybody
True.
should know about Anne of Green
Yes.
Gables.
Oh.
And then I went
Wait,
to vet school at Anne
You
of
don't
Green
know about
Gables
Anne of Green
land.
Gables?
I know of Anne of Green Gables.
I have read 2 Anne of Green Gables books. Is that embarrassing or is
Is
that
anyone
cool?
believing
That means you have a girl child.
Yes, it's true.
Oh.
It's very true. Good guess.
He has
all
a
that
girl
means.
child.
Yes.
Yes.
Girl child.
Yeah.
Okay, moving on.
Okay.
Not important.
So PEI, and then you went to?
And then I went to from Prince Edward Island. I then decided, well, I better specialize. So I went to Ontario. So I went to the University of Guelph, where I specialized.
Okay.
So I landed there for an internship. They kept me for a residency.
Yeah,
What?
Good for you.
I
Good for
They
them.
lucked out.
At the Ontario Veterinary College.
Yeah.
Fantastic place. Then I practiced in Toronto for many years before I moved to Florida. So
Similar weather. Toronto,
Similar, yeah.
Florida.
same.
Yeah. Yeah.
Snows all the time.
That's right.
Snows never of the time.
Right.
So,
So do you guys even have ticks in Canada?
We are we have very few ticks, actually.
Yeah.
It's not as common, and I have learned a lot from being in Florida.
Yeah.
About
Florida's
ticks.
got a lot of everything.
Florida has
Bad bugs, bad plants.
a lot of things that can kill you.
Everything
good
grows
bugs,
well.
good plants.
Yes.
Everything grows in Florida, for
That's
sure.
right.
Yeah.
That's right.
Poisonous snakes, poisonous plants.
All
poison-
5
all the
venomous
things.
snakes native to North America occur in Florida.
Yes.
Yes.
Wow, I didn't know that.
Nobody
You didn't
told
know
me
that?
that when I was moving.
Oh, yeah.
That would have been
It's true.
probably a game
They don't
changer.
put those on the brochures.
They do not.
Immigration. Not even
That's
at
right.
immigration.
No.
Let me write in. Didn't say. Are you sure about the
Are you
Florida
sure?
snakes?
There's venomous snakes, yeah. So, we're going to talk about tick-borne diseases. So, first of all, I have to ask you, do you have a favorite tick-borne disease?
Oh, well, I feel like
Yes.
since we're speaking so
I know it
highly
better
of
be.
Lyme
I know it better
today,
be.
Uh-oh.
but I do have to say that when I said Lyme disease, somebody said Lyme as in L-I-M-E, and I'm like, no, that type of Lyme keeps you from getting scurvy, but it's not super infectious. Right?
No, I don't think
Lyme's
so.
Good for drinks.
Yes, like I said.
Yes.
Always about the cocktail.
Good for drinks.
Now you
So,
see why we invited her into the Candyverse. That's right. That's right.
ridiculousness.
Yes.
That's
for,
why.
for carrying on. Yeah. Okay.
So
we are going to take a very quick break. Don't give me the look over there, Dr. Jason. We got to pay the bills.
I was
you know
saying,
it.
good job. That's the first time I haven't had to remind you.
Oh,
Good job.
okay. We're going to take a short break, and then when we come back, we're going to dig right into Lyme disease with Dr. Dawn. So hang with us. See you on the other side.
When it comes to vaccines, you have a choice. Keep it clean with Ultra Duramune. These highly purified, half-milliliter dose vaccines are designed to minimize the reactions associated with unwanted proteins and reduce discomfort. Keep the good, clean fun going with Ultra Duramune. Learn more at elaneco.us.
Oh, sure. It's all fun and games until someone ends up in a cone. That's right. We're animals. Deal with it. Pet Life Radio. Let's talk pets.
Okay, welcome back. Welcome back, where we are chatting with Dr. Dawn Martin all about tick-borne disease and Lyme disease with a focus because it comes from ticks.
it does. One tick in particular.
Oh.
What?
Which tick is
I
that?
didn't know.
Ew.
That's why I'm here.
Which
Well,
tick is that?
It has many names. It goes by the deer tick, Ixodes.
Oh, Ixodes. Okay, that's what I know.
Yes.
That's the only thing I know.
And then, so I think that it's a very cool tick-ish. Cool tick. As long as you don't get it on you.
Yeah, I don't want it. I don't
No.
want any ticks, though.
I don't want any ticks. We can talk about that later.
Yeah.
how we're not going
That's right.
to pick.
So tell me, because I thought, Lyme disease was a thing, like, years ago, right? Everyone was worried about Lyme, and then it seems like it evaporated.
Not too many years ago, right? Is it super? I don't think it's super old.
No, it's not super old. I mean, I don't know when it. Do you know when it was discovered?
I do.
Look, he's
I
got
do.
Dr. Jason has a
I
fact.
also know. Do y'all know why it's called Lyme disease?
I know that part.
Okay,
know
well,
that
do y'all know why it's called Lyme disease? No, we don't. Tell us. I will tell you. Okay. It's called Lyme disease because it was discovered in Lyme, Connecticut. I knew the town. I forgot the state. Knew the town. Anyways, I didn't know that. It's funny. Why are you laughing so hard? All right, I knew more than half of those folks. Anyway,
Okay.
So Lyme, it was discovered in Lyme, Connecticut in 1975, I believe. Is that right? So that's not.
Not very
Let's
old.
be careful. That's not
Not
old
that
at all.
old. That's
all
not
right?
old at
That's
all.
actually quite young.
That is.
Yeah.
It's a very young disease. But, it was a thing for like a
For a
while.
while, yeah.
And then, because everyone was worried about it, it was like, oh, you don't want to get Lyme, don't get a tick because every tick had Lyme.
Yeah.
And then it kind of faded. Like people didn't talk about it anymore. But now it's come back. Like I have clients that'll come in the practice and they'll talk about like, can I get my dog vaccinated for Lyme? Does my dog have Lyme? And I'm like, look, it's only 1 p.m. We don't have no Lymes out.
What's going on here?
happening? No. I'm kidding. But what's happening with that?
So that's a really good question because I think it's a multifaceted question, which I like. Lyme disease was very worried about it for a very long time, and we're still worried about it, of course. There was a recent consensus statement, I guess I shouldn't call it consensus statement, but there's some information from the government making it more of a priority recently.
Really?
So there is a CDC report from a couple of years ago, but that's kind of boring. So the real answer is...
Okay.
The real,
CDC borne.
The real
Let's
answer
get real. That's what
is-
we do in the Candyverse. We get real.
Then we get it real. Okay.
So the real answer is that there is always a lot of Lyme, but the Lyme is very preventable if you are very, very diligent with your tick control. 95% of Lyme is actually centered on 13 states. So if we are very, very careful about that.
99% of Lyme, 95% of Lyme disease cases happen in only 13 states of the U.S.?
One of
Yes,
those
I said 13, but
has to be
it's
Connecticut.
12%. One of those is Connecticut.
They have to,
Well, it
be
has to be
Connecticut.
Connecticut. That's right.
Connecticut.
They're up, are they
Anymore?
like in the Northeast? Well, I'm going to guess
Yes.
stuff around Connecticut,
Yes.
right? Like
Yep.
Vermont.
Oh, are we guessing states?
Massachusetts,
Yeah, all those states around
Maryland,
Connecticut.
Yes.
New
Got 'em all.
York,
New Jersey.
New Jersey.
Idaho.
But then there's some I thought like around
Wait,
like
Idaho's not involved? We're always
no,
leaving out
no,
Idaho.
no.
Poor Idaho.
I know they got plague out there though,
I
right?
guess so.
Yeah,
It's a different
right?
conversation.
Another conversation.
Whole different.
But there
still.
is a cluster like this further, like in the Midwest,
Yes,
right?
Wisconsin.
Wisconsin.
Random. I know. I was like, Wisconsin.
Yeah.
How
What about
did you get
Indiana?
those? Indiana, no, not in the
Oh.
top 95%. I mean, unless maybe they just got off the list, but
Oh,
not
okay.
the top
Okay.
12, which I
Yeah.
misspoke earlier and said 13.
Oh, 12.
12.
Okay.
So top 12 states. So I think that's why in a lot of the country, we don't really worry as much about Lyme
Because
And-
it's not there.
because we have 1% of
Yeah.
the cases. In 2010 in Florida, I mean, because I'm in Florida, in
Right.
2010, there were 56 cases in the entire year.
Total.
Oh, wow.
And 30% of those were brought into us.
Oh,
Like
not
myself,
locally
they
acquired.
were brought into the
People
state,
came to the state already infected.
infected from elsewhere.
Okay, so like we have to like revisit that piece there, right? So because now you're telling me because people move, people travel, and everyone takes their dog now,
Yes.
right? And so if people can come into the state where Lyme disease doesn't happen very often and they're infected with it, does that cause a problem for me?
It could cause a problem for you indirectly.
Okay.
So there's so many interesting things about Lyme.
Yeah.
And so, first of all, I will say that the ticks that jump onto your dog
Yes.
in Connecticut
Uh-huh.
and travel.
With the Lyme. Do they have the
with
Lyme?
with
Okay, with Lyme.
Lyme, with
Yes.
the Lyme. So they bring the Lyme to Florida,
Okay.
and then they jump off. That tick gets off.
Oh.
That tick is probably not going to eat again.
Oh, that's right, because they only eat one time for each of their life stages.
A huge blood meal. So then
Yeah.
they're not going to bite you.
Which means-
So you're not
not
You're
a
safe.
big
You're
deal.
not going to get the Lyme.
Okay.
Now that Lyme is still there. So
Right.
yes, the answer is that there are reservoirs of Lyme.
Okay.
So the one of the interesting, and again I say Florida because one of the most interesting things in Florida is that a lot of the Ixodes ticks in Florida will feed on reptiles and
Yes.
right?
They're not as discriminating.
They're not.
They are not. They will
How are
and
they going to feed on a reptile? I mean, they got very few choices of where to bite, right?
Tough.
Tough
well,
skin.
that's
That's
why
right.
they have those little bitey parts.
That's right.
But
I guess
those
right
bitey
through it.
parts
I
get
guess
in
little
there.
bitey parts. That's why we have internists on and little bitey parts.
That's right.
Bitey parts.
That's a scientific term from the internist.
We all know what we're talking
Right.
about.
I went to school for a long time, so I could say
So you can say
bitey
it.
parts
Bitey parts. Okay. Yes.
in the
love it.
Candyverse.
That's right. That's right.
Well, thank you for having me. Anyways, I won't be invited back. It's okay. I'll be fine. So the reptiles and the iguanas are actually they don't act as very good hosts for Lyme. So
Okay.
they don't present the Lyme to the next tick very well.
Oh, that's interesting.
They don't. They're not a very good part
So it
of
just
the
stops
puzzle.
there. It just kind of goes away
Yeah,
right
so
there.
all
It's like
those-
a dead
It
end.
stays within the
It's a
almost
dead
like a dead.
end.
It doesn't pass on. If they pass on,
Not
then
very
replicate
efficiently.
inside.
Right. Okay, so
fantastic.
let's review this very quickly for people who are not in those 12 states that have 95% of the Lyme cases. Right? So it is vector borne,
Yes.
right? The fancy word for transmitted by a tick or a mosquito or something. So it's tick. So the tick has it, and the tick gives it bites the dog or the person
Yes.
and gives it to them.
Yes.
What are they giving them? It's not a virus, right?
It's a rickettsial bacteria.
Oh, Jason, do you hear that? It's a rickettsial bacteria.
Yeah, it's very fancy. Fancy.
Fancy.
It's
I'm surprised you didn't say rickettsial, eh?
Hey,
I was like, I don't know if that was like a Great Britain / Canadian accent.
That's
so
right.
Sorry. Anyway,
That's right.
It's terrible.
So
Maybe Australian
then the bacteria gets in the person,
Yes.
Or the dog, and it's circulating around. And how do we know they have it? Like, what are the clinical?
They turn green.
Because it's Lyme. Because it's Lyme disease.
It's pretty obvious. To
But
me.
they don't get scurvy.
And
they
do not.
don't.
They're very safe from scurvy.
So what are the most common clinical signs? Like, if I was concerned that my dog or my cat, can cats get it?
Cats don't get Lyme. Experimentally,
Yeah.
you can show that the Lyme will get into a cat, but they don't get Lyme disease, as far as we know.
Right, not yet. Has not yet been identified in a cat.
Yes, to my knowledge, which is what you
Interesting.
should always learn that phrase.
Yeah.
To my knowledge.
As far as I know,
Right, spoken like a true internist. To my
correct.
knowledge,
Exactly.
today, right?
Today.
That's right. So cat. I don't have to worry about my cat, but my dog.
Yes.
So then my dog. Let's say my dog has it. How will I know?
So, should we review people first because people are so much more
We
obvious?
should.
Okay, so in people,
Yeah.
you'll get this target lesion, right?
Oh,
so
that's
you'll
right,
get
the giant red-
the
You see a
big
big red
target
thing, yeah.
lesion,
Yeah.
which is great because then you know that you've been infected, so you can actually seek medical attention.
it's
That
cheating,
is-
right? Cheating.
Exactly.
That's what I say. It's cheating.
Right,
People
it's
cheat.
so easy. People know you had it.
I mean,
too.
physicians have it easy.
It's
Okay,
ridiculous, right?
Come
One
on.
species, big giant ring that says that's what this
That's
is.
what this is.
a big
Come on.
target.
That's right.
That says
That's right.
I
Okay.
am.
And a
Lyme,
person
or
knows-
maybe one other disease, but
A person knows because this causes like it's a real problem, right? Like chronic, long-term clinical symptoms in a person.
So
Or no?
acute disease, which is fever, malaise, this rash, and then yes, chronic.
giant target.
There's a lot of target, and then there's a lot of chronic illnesses in people that are associated with Lyme disease that are very a lot of immune diseases,
Okay.
immune consequences. So, and that's better served
Yeah.
by MDs.
Correct.
Yeah.
M.D.
We are not MDs.
No, nor
No.
would we pretend.
No.
So-
Well, I might. I don't know.
On TV,
I could play one on TV.
You do have a nice lab coat.
See?
So
You do have a nice lab coat, right? That's all it takes.
I do.
Yes. There you
Anyhow.
go.
Okay.
We're not slamming on NDs though.
No,
Sorry,
no. But we're just
NDs
not gonna treat
everywhere.
people.
We're not going to do that.
No.
So then in dogs, they do get an erythematous rash, but of course your dog is not going to be as forthcoming with saying, "Hey, I noticed that I have a
Yeah.
big red rash."
I was going to say, so Jason, did you
In
hear
the
that big
fur.
old word she said?
I don't ask me to spell it or pronounce it again.
Erythematous.
I couldn't-
Erythematous. It'll get you a buttload of points on Scrabble.
Yeah.
And also, it just means giant red rash.
Yes.
Right?
So, exactly.
Yeah.
So
Okay.
there'll be a red spot. How about red spot?
Which I can see through
Red
my
spot.
dog's fur.
Which you
Yeah,
cannot see.
come on.
Oftentimes you'll miss through the dog's fur. So then they'll get joint pain. They can get joint pain and swelling near that erythematous.
Oh.
Listen, I went to
Twice.
school to
You gotta
learn
use
that
it, right?
word.
Yeah.
Look, I have a word that I'm planning to work into the convo today.
Ooh,
Yeah.
I can't wait.
Yeah.
Okay, good.
Says the person who
It's not
just shortened the word
erythematous.
conversation to convo. Okay, let's share your
Don't
big
judge.
words, Dr. Jen.
It's
We
not
do not
conversation.
judge in the Candyverse.
Okay.
Yeah. Okay.
So then the dogs can get joint disease. They can get malaise and fever as well.
So they just lay around.
They just lay around.
Like ADR, they ain't
And
doing
they
right.
say,
Yes.
my knee hurts.
My knee
hips
hurts
hurt.
because I was bitten on the
Come
back
on,
leg.
let's fix it.
Yes.
And so if I'm concerned about that because I found a tick on my dog, it was just crawling on my dog. Take it off. Because this is what clients do, right? They find a tick on their dog and they rush into the practice and they say, "Oh my God, I found a tick on my dog." But that tick wasn't really on the dog, right? Because it wasn't biting the dog. It was just crawling on the dog.
So you say, "Wow, that's fantastic. I'm so glad that you were looking on your dog for ticks because that's exactly what you should do when you found it before it attached."
Okay.
Because without attachment, you can't get infection.
Right. It's not, there's no excitement without attachment.
I don't remember a lot from vet school. Let's just be honest, all right? But I think I remember something about this disease where it's not like a lot of the other vector-borne disease where it's bite, boom, you got it. It's a little bit different, right? It's something about
No.
27
Boom,
years
infection.
that tick has to be on there or
Boom,
something like
infection.
that. Boom, infection. None of that. That's
No.
not happening. It's a little bit longer. Is that right? Or
Right.
not?
2
I
to
remember
4
that
days.
correctly? Okay.
You're
2
right.
to 4 days.
2
Day?
to 4
Wait.
days.
I was kind of kidding. 2 to 4
No,
days?
2 to 4 days.
I feel so much better.
Yeah.
Yes, 36 hours at the lowest amount, the lowest sort of data that I could find. And that's experimental infection. And here's the other really cool part.
Yeah.
Most dogs don't get clinical signs or get disease. Most dogs won't get disease even if they do get the Lyme into their bloodstream.
Okay. So even if they get the bacteria, the rickettsial bacteria, the Borrelia burgdorferi.
Yeah.
It sounds fancy.
It does.
One of the coolest things from vet school is saying that over and over. You
Yes.
sound super smart everywhere.
Yes.
What are you talking about? Borrelia burgdorferi. Everybody knows that.
I know, but it kind of sounds like a giant department store.
Yeah, it really does.
It sounds like it does. So it's burgdorferi.
Yeah.
So even though the dogs don't often get infected with the bacteria, even though the tick attaches.
So they won't get infected if you find it within 2 to 4 days.
Okay.
And then they won't, even if they do get infected, most of those dogs are asymptomatic.
Oh, no signs at all.
No signs. Completely. So in those 12 states where it's meandering around, even those dogs are wandering around asymptomatically.
So we don't know that. But can they serve as a source of infection? Like if a tick that doesn't have the bacteria in their gut bites them, can the tick take the bacteria from the dog?
Theoretically, yes. So those are...
Theoretically, they can serve as like a reservoir.
Exactly.
That's
type
one of
of a
those.
thing.
As far as we know, we think so.
Yeah.
Yes, theoretically. Now, the amount of Lyme in the patient might impact that.
Sure.
How much is circulating in the blood? Right. If it's enough that the tick bites them and is able to get enough bacteria just for the amount of the blood meal. But then, a lot of times, like if it's the last stage of that tick, because the ixodes, right, they have the three stages, right? The larva, the nymph, and the adult. Yes. And if it's an adult that bites on the dog and sucks up the Lyme bacteria and then falls off, then do the progeny of the tick, the eggs, the larva, do they have it? Because otherwise we're dead. Like we're done.
Right.
It's totally dead-ended.
We're not dead.
Except that they are...
The progression
the infection is done.
You gotta be careful here.
I
We're
know.
dead. That's it.
I know.
Close up shop.
It's a wrap.
Yeah.
Yeah. No.
So
That's a good
that's a really good question, because I do not think that it goes into the eggs, but I will tell you that I will defer to more experts.
You know what? I'm not sure if that's even well known. I don't know if that's been characterized yet.
Right.
Because we do know that this is one of those odd bacteria that is passed transstadially.
There it was.
That's the word.
You're the winner.
That's the word.
The only reason you brought up all the stages of the ticks is you can say, I know, and then use this word. Set that up like 3 sentences ago.
I know. All day people have been trying to work it in. Right, he said Bergdorferi. Okay. But because if it's infected as a larva and then it becomes hatches out or whatever, becomes a nymph, and then if it then morphs to an adult, if it's infected at the nymphal stage, it maintains that infection in the tick until an adult, and then the adult bites something.
Yes.
Yeah, and then the nymph can bite something and give it to him too.
In fact, the nymphs are cause more infection than the adults.
Oh, wow.
You know why?
Why?
Because they're smaller.
Oh, there's...
People don't find them.
Yeah, you don't even see them looking at you.
So the nymphs, people and dogs, the nymphs are in charge of, responsible for, more precisely, for more infections.
Wow.
All right. There's a whole bunch of stuff about parasitology. It's all super interesting.
They're all really tiny.
Super great ticks, all fantastic. Listen, can I treat this disease? Is this something that's treatable?
Well, but it doesn't have symptoms.
What?
They're like most dogs don't have clinical signs.
If I I've got to diagnose it first. Let's diagnose. I got a dog comes in. Okay. I jump to. I just want to help my clients out.
How are we going to fix it?
If we can't fix it, how do we diagnose it? How do we fix it?
How can we do any of these things?
Is it possible? Or we just kind of, Dr. Jen just said we're all dead, so maybe.
I didn't say that.
I think you did say
that.
The
infection is over.
We shall review the tape later.
Okay.
All right.
Okay, so we're living in one of those 12 states.
Okay.
We're in one of the 12 states.
We're
so
cold,
we have
most
an
likely.
index of suspicion. We're probably cold.
So the likelihood of exposure to the dog is high.
Exactly.
Okay.
We have the potential of exposure, so the dog walks in the door and it has fever and it has really swollen joints.
Yeah. Okay.
So we're probably thinking, possibility.
Could be Lyme.
No,
I personally would shave the dog bald looking for that target spot.
Looking for the target lesion.
Is that not what I should do?
Too late.
Oh, wow, you're right. Well, I got diagnosed.
It's already resolved, right?
2 to 4, that erythematous
I'm telling
lesion's
you,
gone.
humans cheat. Let's
That's
just
right.
one more way. All right.
Easy.
Okay.
So then that thing is long gone by the
So
time the dog gets
if we can't find the erythematous
lesion.
rash,
Which apparently you're not going to be able to.
lesion.
Also a good word.
It's a good word.
Yeah.
Okay.
So if we can't find that, then how are we supposed to test for it? Because I have had clients come in and they winter down here in Florida, for 4 to 6 months, and they know all about Lyme, and they come in and say, "I'm concerned that my dog is infected with Lyme. What am I doing at that point?"
So at that point is the perfect time because they've been down here for a bit because it takes weeks for the antibody response to come. So
that's right.
But the interesting thing is that the Lyme disease, the Lyme clinical signs are also going to take weeks to develop. So by the time most dogs have clinical signs, they will have antibodies.
Okay.
So you can test for the antibodies.
So we can just do a titer.
We can do a titer.
Yep.
Is there an ELISA though? Isn't there's a in the clinic ELISA test that we can do, a SNAP test?
The SNAP test that actually detects the C6, and so there is a protein on that Lyme that is naturally acquired. There's a protein that it only makes in a natural infection.
Right.
Gotcha.
And that is the best test for the antibodies.
Because that's saying, I see
Absolutely.
you're there.
Yeah.
Versus the antibodies, because as we all know, you can have just exposure but not infection that produces a high antibody titer.
Yes.
And you can have vaccination that can produce an antibody titer. And then you can also have infection. So you don't know which one it is if you have a high titer.
Right.
Potentially.
Potentially. And that's absolutely true with Lyme, and actually kind of a pain with Lyme because a lot of those dogs. So a couple things about that is that, first of all, yes. So even if you have had the exposure and you have a positive SNAP test or it's a positive C6 test for antibodies, then you still could have an exposure that you've cleared, or you can have an exposure that's actively causing the dog's arthritis.
Right.
And just to throw everything into the mix, there's also 1/3 to 45% of those dogs will also have another bacteria that's carried by the ixodes that also can cause similar signs. Right.
Did that start with an A?
Yes.
What's up? I only know because, on the little test kit, you get all the little dots that tell you the things. And I'm thinking it has to be the same one.
Yes.
That's on there, right? Is it anaplasma?
Anaplasma.
Yeah.
Phagocytophilum.
Yeah.
Yes.
Oh, wait, I'm sorry. She just said another fancy word. What did you say?
That's like Bergdorfia.
Anaplasma.
Phagocytophilum.
Phagocytophilum.
Phago.
Phagocytophilum. I'm waiting for Jason to pop out with Bergdorfer on.
No, I've already said it twice. You get a limit. Otherwise, you just sound worse. So
That's
2
right.
times, you still sound smart. 3 times, I've learned from personal experience, you just sound like a dork.
Okay. Okay,
That's really
so
funny.
anaplasma and Lyme can cross-react on the test.
They actually come in the same tick.
Oh, okay.
They literally, yes, they can cross-react, but also they come in together.
the same tick.
So they do have co-infections with both of those. So they have kind of similar clinical signs.
You guys delve into the science, and I'm going to back it a little bit.
what are we
Do
gonna
I have
treat
a
it?
test that I can use?
Yes.
So
But it's not like on TV where it's like a touch up, done, positive or negative. There's all kinds of
the
extraneous factors in
screen.
interpretation. Okay.
So
All right.
unfortunately,
It's not as easy as it should be. I mean,
As it could
can
be.
be.
Yeah.
Right. But if you have a dog that has clinical signs of arthritis and it has a positive Lyme and it has probable exposure,
Like
does
spend
not live
time
in
in one of
Idaho,
those
right?
states.
It's not a dog from Idaho that has all this. Idaho, you're
Well,
not
it
going
could
to
be a dog in Idaho that's visited.
No visiting.
Oh, no visiting.
No visiting.
Sorry,
So
no
not-
visits.
yeah.
okay.
No visits. They just hung out in Idaho.
Okay, but you have all those things you can say. Okay,
yes.
we're going to go with Lyme.
So then you want to know how to treat it.
Yes, I do.
That's what you really want
That's
to know.
what
That's what I
everybody
wanted
wants to
to
know,
know.
right?
So the answer is that we want to treat it with an antibiotic. And yes, there are many antibiotics that will have some effectiveness or efficacy against Lyme, but there is a possibility that we're not going to cure that Lyme. So just be aware that there is possibility that's the rub.
Yeah.
So most clinical guidelines are for 4 weeks of doxycycline.
4 weeks of doxycycline.
Okay.
You can still have dogs that will be positive after 4 weeks of doxycycline.
But will the clinical signs resolve?
Yes.
Even if they
Yeah,
remain
and that's what
positive?
most
and I
of
think
us
that's,
want to take care of.
yeah,
right?
I think we just want the
Correct.
dog not to have their joints aching.
Yeah, we do care
right?
that there's a Bergdorf. I can't say it 3 times. You only get to say it twice, and then
That's
karma
it.
hits it,
You're
right?
done. You're done.
Floating around, you just don't
Yes.
want to be floating around and painful and sick. You want to take care of all that.
Yes.
and
So they will feel remarkably better.
that's great. You can be a hero. I mean, the dog can feel better.
Oh, the dog can feel better.
Absolutely.
Okay, so we can avoid all of that, right?
Sure.
We know we're going to get it. We know how we get it, right? With the tick bite from the ixodes, and they got to stay on for a while. We know how to test for it. Yeah. We know how to treat it.
And thanks to Dr. Jen, we know all the life stages of the tick. Go ahead.
You can have it. Transstadial. Well, look, man, you try to work that into a conversation and have it sound natural.
That did not sound natural. Oh, sorry. Carry on.
Whatevs.
She set it up well.
So there's a way we can prevent it, right? Because I can prevent the tick from getting on my dog. I can use effective tick prevention. But there is a vaccine, right? I mean, because I've used it on dogs for clients. So tell me about the vaccine. Is it effective? Should we do it? Should every dog get it? Like, what are we doing there with that?
And that's a great question, because vaccine questions are never straightforward, right?
No.
Well, sometimes they are.
Yeah.
But for Lyme disease, the answer is depending on where you live, depending on what kind of property you have.
Yeah.
So that's such a medicine.
Again, poor Idaho. No point in doing it in Idaho.
Yeah.
It's a waste of whatever, and maybe not great for the dogs.
So what I'm hearing from an internist is that this determination about whether or not to vaccinate the dog for Lyme should be a risk-based assessment. Is that right?
Yes, absolutely. Yes.
I mean, what a concept, right?
What a concept. Yes. Yeah. So if you live in one of those states where there's a high risk of Lyme, and you know that you live in a place where there's a ton of ticks, the Lyme vaccine is very effective. There's no doubt about that. The problem is that the Lyme disease is only going to protect for Lyme. So if you're going to have a dog that has ticks on it every day, you're only going to protect for that one, for Lyme disease. You're not protecting for anaplasma,
or Ehrlichia, or any of the other tick-borne diseases of interest.
So by far, the best thing to do is to control your tick population on your dog. So make sure that your dog is on a tick medication. Make sure that you check your dog for ticks all the time. Make sure you check all the humans for ticks. I mean, of course, the humans. Damn humans.
And also shave your dog every day.
And if you're in Dr. Jason's house, you're going to be a naked dog.
No, I wouldn't do that. So you could do that.
Naked dog looking for the erythematous lesion.
Depends on how much you're worried about ticks.
I know. Okay, so I'm going to ask you another question about Lyme. And this is a little bit far afield, folks, but I mean, if you're not new to the Candyverse, if you're ready for this. Okay, so it's called the deer tick, right? Because you said the tick had many names. And so what I have heard is that people have said that one of the reasons that we're seeing an increase in the number of cases of Lyme disease is because the deer tick has more available and appropriate hosts, i.e. the deer population is going berserk in those areas that you're talking about that have 95% of the Lyme cases. Right?
Okay.
So is that real? Is that correct? Like, what do you think about that?
That's a good question.
Because they don't have to feed on deer, even though it's the deer tick, right? Like, we know they can feed on anything.
It probably takes you have to know more about the deer tick to answer that question, right or wrong. That's an interesting
It is an interesting
theory.
question.
It would make sense to me. If all of that's true, it makes sense.
Yes, it is logical. And the mice population, of course.
Right, because they start on a mouse,
Exactly.
and then, ostensibly, right, the ideal situation, the tick said, let me pick how my life is going to go. I start on a mouse with my first feet, then I get on a deer, right, and then I drop off and lay eggs.
Yes.
I mean, and your life is over, and that's it.
And it was successful.
It was very successful at that point.
As an Ixodes, you've lived a very
full life.
Fulfilled life.
That's right.
That's true. So I could see that either of those populations increasing would, of course, increase our exposure. Interestingly, they did do a study, and I think that the University of Tennessee was the one who brought this study forward, and they used the vaccine that they were originally going to develop for canine, and they took it and they changed it into a mouse vaccine that was orally.
They were vaccinating the mice.
So
that's interesting.
That's interesting.
It was very successful, but it's not.
That's not reasonable.
It's not reasonable on the long-term scale.
No.
But how cool.
Yeah.
I thought it was really cool.
Well,
Anyways.
that's like deworming the cockroaches so that they don't give sarcoidosis to your birds.
Yeah.
Well, I think that we should just give everybody a possum so that they eat all the ticks.
Yes.
What do you think of that idea?
No, that's not effective.
No, not a good idea.
Yeah. So there was a thing, though, that went around Facebook that said, all you should do is just, throw a couple of opossums into your yard and you'll have no ticks.
Well, I follow all advice on Facebook, so I know I did that.
I mean, it is a news outlet, right?
No, it's got a lot of opossums.
It's not a social network. It's a news outlet.
It's a news outlet.
Right. Yeah. No, do not get your veterinary advice from the Facebook, right? Come into the Candyverse where we bring experts.
That's right.
Right? We bring the experts into you. So, okay, good. So as a conscientious pet owner or as a veterinarian that's taking care of pets that travel, I want to become aware of where those 12 states are. I want to make sure I have the Lyme vaccine because it is effective, available so that if I assess the risk for that pet, I can administer it. Oh, I wonder, is it safe? I wonder what the adverse reaction rate is for Lyme vaccines.
So it is slightly higher than regular vaccines.
It is.
So the adverse events are higher,
But we can fix that. Like, I mean, I can...
Again, risk assessment, risk reward.
Risk
And then you got to decide what,
Yeah.
and this is a conversation to have.
Yeah,
sure.
I would agree.
And I think that there are a lot of veterinarians that are so well versed in those states.
Yep.
I mean, that see it every day. That
better be.
90% of their population is wandering around that has had exposure.
Yeah.
And then, maybe we should say one tiny bit of info about that Lyme nephritis because
that's bad.
It is bad. So there is a lot of talk in human medicine about the chronic illnesses, and they have a lot of different type of chronic illnesses, including meningitis and things that obviously we don't see in
related to Lyme infection.
Lyme specific,
Lyme disease.
Chronic Lyme can cause neurologic disease. We don't see that it's not recognized
in dogs.
In dogs that we get those chronic long-term sequelae, except for that really serious nephritis, which is a kidney disease, where the Lyme and the Lyme antibodies. The Lyme causes a lot of antibodies. That immune reaction causes damage to the kidney, and the immune reaction itself is damaging rather than the Lyme.
Right.
The good news, bad news. Good news is that is very uncommon. So less than 1% of dogs will get
Oh my gosh, less than 1%.
Yes.
So more than 99% of dogs get the arthritis, the arthritic kind of version of it, and then that unfortunate,
chronic, long,
really special
Yes.
part of the dog population
Yes.
gets the nephritis.
Correct. And then the bad news part about that is that if you are a Labrador Retriever, a Golden Retriever, maybe a Sheltie, and maybe a Bernese Mountain Dog.
Mountain Dogs, like all I know is Bernese Mountain Dogs, Lyme disease, kidney failure.
Yeah.
Right?
So even in those populations, though, even in those 4 breeds, it's still very rare, but that's maybe one of the reasons that I would, this is me, not this, I might consider those breeds getting vaccinated.
Yeah. Absolutely, especially if they frequent areas of high exposure and
like
higher
lots
risk.
of trees,
Yeah.
your deer come right up to your backyard. Hopefully that's not kind of happening all the time, but but it would be better, obviously, to have a tick-free zone in your backyard, and there's tons of data out there on how to create that. But yes, I just want to mention that for our public service announcement.
Our public service announcement.
About
You heard it here
at
first.
least we don't have too much chronic sequela.
Right. At least dogs just get the arthritic version, and we can remedy that largely with a long course of antibiotics, 4 weeks. So, yeah. Okay, good. So, very quick question. If you had to pick, would you rather have Lyme disease or anaplasm?
Am I a dog or a human?
You're a human.
I'm a human. Ooh.
Yeah.
I think. Oh, how long ago did I get it? 'Cause I haven't. No.
Like, why do I have all these?
You started
She's
feeling
an
sick 2
internist.
weeks ago.
Because
She's totally an internist. Did you hear that? I want all the details. I'm going to need more detail on
I'm
that.
going to need more data.
You can't just pick one.
Did the Lyme come in within the last few hours?
No. No, you've had it
Okay.
for like a month.
Oh, I don't want that.
Okay.
I guess
What are you
I'm going to
picking?
go with anaplasma. Because,
okay.
Can I tell you the answer to my question?
Yeah.
If you know that you get Lyme, if you know you've been bitten by that tick, and you take 1 dose of doxycycline, I read this is a random tidbit, I read that 87%, they must have made some poor people do this test. 87% of the time you can get rid of
the Lyme?
the bacteria by 1 dose of doxycycline.
Only 13% of people poor people. 87% were happy.
Hey.
Exactly. So I was going to say, my real answer was if the Lyme was just inside, I would take Lyme and I would take some
Then you would
doxy.
take the Lyme because you could get rid of it. Okay. That's a fair answer. That's a
a long answer.
No, but I mean, we expect nothing less in the Candyverse with an internist.
Yes.
Yes.
Well thought out answer.
That's
To
right.
an interesting question.
A very, very in-depth answer. That's right. Yeah. So, Dr. Jason,
Yes.
anything else you want to know about Lyme disease?
No. Is there anything else to know about Lyme disease? No. As always, you guys have fulfilled my thirst for knowledge here on the
Your thirst for the knowledge?
Yep.
Okay. All right. Well, thank you so much, Dr. Dawn Martin, for joining us in the Candyverse. We love it.
Thank you for having me.
And we hope you'll come back and give us some more in-depth answers on medicine.
A long answer to a short question.
Yes.
Always the best.
That's what we love.
Internal medicine.
No, it's been wonderful. Thank you so much for joining us. And thank you all for joining us in the Candyverse. And I guess I'm just going to sign off and say I'm Dr. Jen.
And I'm Dr. Jason.
And we will see you on the next episode of In Other News.
Ciao, baby.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.